So as folks are sitting down, I just want to offer, again, thanks to the organizers of this workshop. I think that this kind of breakout is a little bit new for this committee, and I think that, I mean, it's impossible to synthesize everything that has just happened in this panel. I think we're all kind of struggling with that, but it really was a very, I think, productive discussion we have, and it definitely will inform where we go. I'm going to take one prerogative and just add to this thought about who's not in the room, and I really appreciate the mentions of the major foundations. Just adding to Josh, in terms of research collaborations, there is something called the Belmont Forum, which has existed for about 8 years. It's focused on global environmental science and atmospheric science, and just in this year, there is a group of about 13 different countries who are putting forward a collaborative research action under the Belmont Forum on climate, environment, and health, very much in this same space. And one of the things about the Belmont Forum is that it really very explicitly incorporates social sciences with all of these hard sciences. So when we talk about building on infrastructure, that is an infrastructure we can definitely build on, but that's an international consortium. And I just want to, one more time acknowledge who else is not in the room, and these are my dear colleagues in the federal government who should be here, who absolutely should be here in this room, the people from NASA who give us the remote sensing, the people from NOAA who give us the meteorologic observations and the modeling and the research and the science, people from the National Science Foundation. These are voices that really will obviously have to be in this conversation. Before I introduce our panelists, I just wanted to, we've heard a lot today, and we are now going to have a panel that's hopefully focusing on the what next, what for, and what do we do about this? And my own reaction, I don't know if this is helpful, but there are kind of three kinds of issues that have kind of jumped out at me, or three bins to put all of the things that we've heard in terms of how do we act on them. One of those groups are the epiphanies. I think we've had some aha moments. We've had discussion about dogma breakers, silo breakers, paradigm breakers, kind of thinking in a very new way. Things where we feel like we have fairly high certainty, like things like the importance of the first few months of a neonate's life and the interactions with the microbiome. We may not have complete knowledge of what to do about it, but fairly high certainty, new knowledge. The second category are the things that I would say, are really old knowledge. In my teaching, I always love the quote from Benjamin Franklin, about how long an important truth can be known before it's acted upon, and he was writing about lead 250 years before flint. So in this room, I had people sitting next to me and saying, we know mercury's bad, why don't we just stop burning coal? Why do we have to spend a lot of money to figure out what mercury does to the immune system? It does terrible things, we know this, why don't we just... So it's kind of the issue of expanding our understanding of the impacts of things that we've known about for a long time that we haven't been able to eliminate, and how can this new science, this new knowledge, this new motivation generate perhaps new political will, perhaps new stakeholders. And then the third are what I call hand-wringers. So these are things where it's not a lot of certainty. There's a lot of uncertainty, but the potential implications are so huge. Things like perhaps the vaccine of efficacy. If we lose vaccines and we lose antibiotics, where are we? Things like some of these environmental microbiome in a setting of global environmental change. So low certainty, high impact, new knowledge. How do we think about this? I'm going to shut up now. I've talked too long as it is. And just very briefly introduce our speakers. Our panel has had we are somewhat of a reconstituted panel. We've heard from some of our panel members because they are already speakers. So immediately to my left is Dr. Carlos Santos Burgoa, currently professor at George Washington University, a very long and illustrious history of positions in global health, ranging from senior advisor and acting director, department director at PAHO, to the dean of the Mexico's School of Public Health and its National Institute of Public Health, positions in the Mexican Ministry of Health, and many other positions. To his left is Gina Solomon, a longtime friend and colleague, occupational environmental physician, recently science advisor in the California EPA, the California Department of Environmental Protection, currently splitting time between UCSF as a professor, associate professor, clinical professor, and also with the Public Health Institute. We've been introduced to Dr. Basu, who is with McGill University. He was our speaker this morning. Dr. Ginsberg, who is the director of the Department of the Center for Environmental Health at the New York State Department of Health, formerly with the state of Connecticut as their chief toxicologist. Was that your title?
Yeah, state toxicologist.
State toxicologist. And then all the way on the far end, Dr. Keith Martin, who is the founding director of the Consortium of Universities for Global Health, former parliamentarian of Canada. And one thing that didn't come out in your bio, former field physician for many years in Africa. So a lot of firsthand personal experience of global health and environmental and infectious disease issues. So with that, let me just turn to our panel and let you give introductory comments. I think each of you can, I think we just go free form because there's just been so much turmoil that each of you can take about 5 minutes, if you would, and just give reflections from your viewpoint on what is next. And I'll just go down the table if that's okay.
Fine. Thank you very much for the invitation, and I have had many epiphanies, and I think a lot of old knowledge and things like here. But one thing that came to my mind in this meeting is sometimes, somewhere, environmental health became toxic health, and but we always knew that this epidemiology triad of host, environment, and age and interaction happened. So somewhere we lost track of this this microbial world and the chemical world were really the same world. And this workshop has been amazing for me. No question that in my next risk assessment I will check for the microbiome. Otherwise, I know that my estimates will be biased. Now it makes sense that when I had to confront the H1N1 epidemic in Mexico, I used exposure assessment as my main tool for managing the risk. But now I think I would have to think about arsenic-exposed populations as a vulnerable population. Never thought about that. Now it makes sense to me when I study mycotoxins in the highlands of Guatemala to consider not only on the nutrition and teratogenesis, but also the infectious patterns and interaction with indoor air pollutants. Now it makes sense when studying the mechanism of mortality after Hurricane Maria in Puerto Rico that more than 40% of the deaths were infectious. And in elderly patients, many of them with chronic diseases. But I have to make sure that I know about their environmental exposures and not only by their poverty level. We cannot miss anymore. I think that this is happening in these disaster situations, and also in the legacy situations of TDT, lead, mercury, arsenic, this interaction. It is challenging for chronic diseases management. Now, I don't know, I used to be heading the unit of non-communicable diseases at PAHO. Come on, they are not non-communicable, they are communicable. There is not such a thing. So these two worlds have to get together in some way, the inflammation, the exposome. But how we take this panel is talking about how we take this to decision makers. But what has to be decided here? That's the question. What has to be decided? Why they have to decide something? And I was the last few weeks I was in Mexico, and I talked with several very high-level officers in Mexico, and I have been thinking, why should I tell them about this? what is new? What is the gain about this? Is vaccine efficacy a topic? And they should pay attention to this. Why should they move away from what they have done as business as usual? And I think that what we are talking is really the change of how we are implementing our public health functions. The monitoring and surveillance. I completely applaud the idea of integrating surveillance from infectious diseases and environmental surveillance. Yes, it has to be integrated. We don't have that, and that's a major decision that has to be taken by decision makers at country level. How is this translating into health promotion? How is this brought into regulation? Are we really going to move our risk assessment, risk management paradigm using this? I think this is a major decision that has to be taken on how we are doing our population prevention. My main concern is, okay, if we can't identify what decisions have to be taken, who are going to implement those decisions? And we were discussing in our table the problem of institutional capacity. We have, especially in the global setting, we can identify easily that in public health we have a very, very weak institutional capacity. Our institutions are weak, and this has came after many years of saying that state government institutions are damaging the economy, and that is not true. Public institutions are important for development and for innovation, and we have to do that. So my main concern for this decision making is who is going to implement it in public health systems in the future, and that is my first take. I want to say something about global institutions, but later on.
Yes, we need to move on to make sure we give everybody on the panel time. We've been shortened for our total time. Gina?
Sure. Well, thank you, and I'm really glad to be here. This was a fascinating meeting. In some ways, I guess I'm sort of standing in for someone from US EPA, and I'm really sad that US EPA folks can't be here, though I know some are watching. And but I am unabashedly going to speak from the California perspective, because that's sort of where I am and where I'm thinking. And I was thinking a lot over the last day and a half about what sort of one could grab from this meeting and potentially run with from a policy perspective. And I think that was sort of a lens I was looking at. And there were a few things that popped out. And I really thought that the discussion after lunch yesterday on PFAS was interesting, because there's so much going on that right now, and it is sort of a group of chemicals, class of chemicals that are defined by their immunotoxic effects. And so here we are, with US EPA and various states really having to grapple with that in a very direct way, which they didn't really have to do with arsenic, because the cancer effects tend to drive everything, and on mercury, the neurotoxicity tends to drive. So here we are with some chemicals where we're really going to have to look at that interaction. So that, from a toxicology perspective, I think is going to be very interesting and important chance to act. I really felt like with particulate matter discussion yesterday and the lower respiratory illnesses, that's something that has been overlooked. And there's, there are efforts to look again at PM. Federal effort may not be going anywhere anytime soon, but in California, there is actually quite an active new effort to look at PM. So I want to bring that back and make sure that this issue is front and center in that discussion. But I also, in sort of again thinking about the kinds of things we're facing on the West Coast, I was realizing that in some ways I felt like the scope of this meeting was too narrow. because I was thinking about infectious diseases that affect organisms other than humans, where the human health effects are indirect, not direct. So in other words, turning some of those arrows around. One example that we discussed at the environmental change table is colony collapse disorder in bees. One of the causes being the Varroa mite, other causes being many, including some pesticides and other stressors. And so you have an infection that doesn't affect humans directly, but it certainly has impacts on our food supply that could have profound human health effects. So, can we start thinking about that? And I also mentioned the example of the western bark beetle that is infecting the pine forests, resulting in 130 million dead trees in California, fueling these infernos of wildfires that we're facing. And again, you start putting the pieces together: climate change, drought, infection, smoke inhalation, and displacement. So, can we start thinking about infections? It really requires this real One Health way of thinking, because infectious diseases don't always impact humans to cause health effects in humans. So I just wanted to put that on the table. And I think that I'll leave it at that, but I have other issues, but I want to make sure everybody gets a chance.
Great, thank you,
Thanks.
Gina.
Sure, so I'll keep my comments relatively brief since I had a while to speak this morning. But upon further reflections, it's clear that a range of disciplines are here, that in each of our arenas there are tremendous innovations underway, that we're seeing the world in very different ways and in much deeper ways. There are new technologies that are emerging that each of us in our disciplines are able to harness, yet we still struggle to sort of come together. There are many different ways to come together, but one aspect which I don't think I've heard much of in this meeting is to harness our students. I think there's one mention of a grad student being here, so thank you for being here. I have to say, being in a university setting is the students that sort of have this the energy and sort of the I shouldn't say empty brains, but their brains aren't quite sort of geared to think a certain way yet, that they're quite liberal and free-flowing in terms of how to make connections. And a few programs that I've been involved with in which we've had to come together in interdisciplinary ways, I find that we're able to go to the next level, not through the professors discussing, but rather through the students having discussions. So I think there's something to be said about bringing students into this discussion to harness their energies and their ideas. Now, a lot of the things that we discuss here in the comfort of a beautiful room and a setting. The issues that sort of motivate us are situated places far, far away from here that are highly resource limited, and we need to do more to get to the communities, to the fields. So then, coming back to, let's say, the student issue, how can we now flip this to now get the students who here are gaining great education in our higher institutions to now work with the students that exist in the low and middle income countries who experience day in and day out the firsthand issues related to inadequate sanitation or poor nutrition or malaria and so on and so forth. So better connecting with folks on the ground, especially at a student level, I think is something that may reap benefits, not only for now in our ways to view things more holistically, but also starting to pave the way towards a more sustainable future. And then the next thing I'll just briefly touch upon, I think I've mentioned this a few times, is that science will only take us so far. And in order for us to have truly translational impacts, we need to hand it off to folks that can then use that scientific knowledge to make an impact through policies, laws, legislations, which ultimately is where we want to go. But we need to document that. Oftentimes we hear that these things take time and they cost resources and money. I would counter that the costs of inaction are far higher than the costs of action. And somehow we need to better document this through economic studies, through engagement with a range of other disciplines that don't usually come to the table here, and put more of an economic perspective on this, more of a security perspective on this, to better highlight that the cost of inaction far outstrip the cost of action. I'll stop there.
Thank you.
So when I heard that the emerging science panel of this National Academies was organizing a workshop around this, I was in the front row raising my hand to sign up because, you know, as a toxicologist for 30 plus years and having gone through risk assessments that were based upon cancer as an endpoint or based upon development or neurodevelopment as an endpoint, you know, we've learned a lot about how to test for those endpoints, about how to put them into risk models. I've spent a fair bit of time doing risk-benefit analysis on things like fish consumption, on what is the risk-benefit from, say, mercury and omega-3s in a certain species of fish, but realizing all the time that there's other endpoints, and which may be risk drivers, which may be policy drivers, but the science wasn't quite there or still trying to inform us in the regulatory mode about needing to pay more attention to those. And a key in my mind has been immunotoxicology, immunocompetence, and more recently my role in New York State in disease prevention, and understanding that the risk factors to the immune system are not all that well understood. The beneficial effects of nutrition, low stress environments, even just having green spaces around. People live, you know that if there's a green space and you never walk into it, but you know that there's a park there, just that helps you live longer and be healthier. So all of these chemical and non-chemical factors that can affect immune health and health in general, we're not well incorporating into our models. And so the fact that we are starting to make inroads and to build a research base and an infrastructure base that can bring this emerging knowledge into something so vital as infectious disease prevention, which is monetizable, which can directly affect cost-benefit analysis in terms of air pollution or in terms of global mercury releases, other kinds of prevention, intervention, things that could be done. So to take our classical interventions, which is vaccinate everybody, and broaden that a bit into what kinds of environmental health factors could be affected in New York State, where we don't get a lot of sunshine and where people are spending a lot of time in front of screens and indoors and not getting any vitamin D compared to what we used to get. So that may be one intervention we can do there, versus in other parts of the world where that's not the issue, but basic food and nutrition and sanitation are other interventions that may not be decreasing the chemical burden, but may help offset the chemical burden. So what are all the different ways that we could start thinking about an integrated intervention network of effects and outreach? So I'm thrilled to be here and hope to be part of the conversation going forward.
Great, thank you very much. Keith, before you speak, I'm just going to open up the conversation to the full room. So if anybody has a question, please go to the microphones and we'll be ready for you when Keith is done.
Thank you very much, John. And once again, much thanks to you and Melissa and Audrey, Keegan, and the teams here who have put this fabulous 2 days together. Much thanks. It takes a tremendous amount of work to do this. It's been a real honor to be here. I've learned a lot from all of you, and so thank you so much for that. I think that just to go down a relatively short list of things that we may want to consider. One is just the collaboration to be able to bring in the CDC, DOD, State Department, and others along the lines of what Josh mentioned. We need to expand upon that. Engage with our representatives from the international groups like the Knowledge Action Network, Andy Haynes, and others who are doing great work globally. The World Bank Environment down the street who are doing great work. The WHO, who at the WHO meeting last year, for I think the first time, they actually did some superb work in actually showcasing the importance of biodiversity and human health. That's a sea change for them. And I think we can't let that go. So we need to find ways to bring them into this conversation so we expand our community that we have here
and tap into that and mobilize us to be able to affect change. On the education side, Linda Birnbaum made a very good corrective point to be able to ensure that these issues are inculcated into grade schools, including high schools and beyond. So we start to inform children who are going to be our future leaders about the importance of what we're doing. And there's a lot of products that exist. National Geographic, for example, here has open access K-12 core congruent material that we only wish we had when we were children, as dynamic, fascinating, and powerful, that can be used by teachers anywhere. Right now, it's actually the teachers in the more affluent schools that access this, which is sad, but we need to democratize that awareness. On the research side, I think we need to, again, along the lines, I think, of what Neil's mentioned, we need to show the rate of return on existing evidence-based solutions and be able to democratize that knowledge in a way that is comprehensible to both public and policymakers. And on identifying the research gaps, which I think is also in the area of, one of many areas, is in identifying the rate of return on evidence-based solutions. So there are gaps there and there are others, but I think we need to find a way to crowdsource those questions from government, from NGOs, from the private sector, and link academia and others, researchers, up with those questions. And then we could have a very fruitful and productive funded mechanism to be able to answer relevant questions to organizations and communities' needs. Lastly, on the communication side, I think we all heard very carefully that we need to up our game in communication. It's not our skill, but there are people who know how to do this. To do it not only through prose, but more importantly, visually, to shorten the sound bites we have, because that's the environment we live in, and to be able to affect not only the coconut, but also importantly, the heart. More importantly, the heart. And lastly, so three things that we could really focus on. One, of course, is strengthening the global health security agenda, investing in capacity building in that, supporting the Paris Agreement for climate change, being able to, as a community, as a biomedical community, fight against the anti-vaxxer movement, which is winning right now, shockingly, with great impacts that we've seen around the world. And then mainstreaming conservation into development, which I'm speaking personally, it's a very important opportunity which we've not really grappled with. We can actually mainstream conservation into sustainable development initiatives that can create resources that can be invested into public goods, particularly in low-resource communities in rural areas. This is a great, not a new opportunity, but it is largely neglected at great cost, given the fact that, as Gina mentioned, we not only have a bee Armageddon, we have an insect Armageddon, as we heard, and we are, in fact, the last generation on our planet. We are the last generation that can arrest the massive loss of biodiversity, the renting and tearing apart of the global biodiversity network that keeps us alive. So as our planet is calling, screaming 911 to us, we have an urgency to act as the generators of the Anthropocene and also the generators of the solutions to address the impact we're having on our planet.
Thank you, Keith. You've definitely reached the coconuts and the hearts with those last words. Very, very compelling and very important words. And thank you to all of our panelists for really wonderful insights. Again, like this workshop, touched on a lot of different issues. I'm going to take 15 seconds for a shameless plug, but since I'm part of the federal government, that's your taxpayer dollars. NIEHS has created, on the topic of education, we have created educational materials that conform with the next-gen standards that address some of this interactive systems thinking. We've just posted those materials in versions suitable for international students, for international public health and clinical students, and for domestic U.S. Clinical and public health students. So eager to continue to develop these materials. The education piece is extremely important. Getting to the, taking complex systems thinking and finding ways to bring that to elementary school students is critical, challenging, very critical, very hard for them to read the National Climate Assessment, but that's what we need to focus on with agreement. We have one person at the microphone.
So I'm going to build on what we just heard there. So with the world essentially going to hell quickly. There's a lot of scientists in this room, and I would suggest to you all that, as Keith just said, we have limited time and money, and so I would challenge the scientists. I want your thoughts on whether or not this is reasonable to do two things. In your next research grant, instead of it being something really narrow and building on something that we already know, why not investigate how the heck we change public opinion on a major environmental issue, which is getting worse as we sit here. And then, so that's my first thought. And then my second thought is, a lot of you control some money. How about making a bigger communications team that really works on influencing the people in a state? Maybe we can develop Virginia very well as an eco state, and that's a model for other states. It doesn't have to focus on the Congress. I would just again point out we're in a city where lobbyists control way more than scientists. It's a full-time job. They make a lot of money. We need to think things differently than we've done, or else we will get what we have always gotten.
Excellent points, critical questions about the science of creating political change and communications. Anybody want to take those up?
Well, I'd like to sort of circle back to some of the things that Maureen said yesterday in her talk, where she talked, gave us little snapshots and case studies. And often at these kinds of meetings, we do talk data, and stories are important. And I thought that Maureen did a good job showing that in her presentation, that we can use story. And I think, this is not a new concept, but there are a lot of stories out there. And I really keep thinking about, population displacement as being such a key driver on the human health front, because population displacement is a result of environmental degradation. It is also a cause of environmental degradation. It is a huge driver both of infectious and non-communicable disease-related health impacts. And it's happening within states, within countries, and across countries, and it's creating enormous stressor tensions as a result. And it's something that is going to happen more and more, and it can take us in a very dark and horrible direction, as we've already seen. And it also could bring out the best in people and result in some really visionary solutions. And I think one challenge along the communications line that I've been thinking a lot about is, how do we get people to see people who have been displaced from their homes as being people that they should welcome and bring in and help support and help integrate into their communities, whether those people are displaced from, wildfire, not too far away, or from some, flood or drought or other issue across the globe. And so, I think there is a way to flip that through story and through, humanization of the problem. And I wonder if there's a way we could do more of that.
Carlos?
Just briefly adding to what you're saying, I had a note here. What is the sense of urgency on making a change on this? And how do we produce that sense of urgency? If there is no such sense, we will keep on doing things business as usual. And I think that these stories have to drive into not only making the argument that it makes logic, but it is urgent to move forward.
Yeah, I'll just follow up on that to add something that kind of came up at our table also, which was the timescale of change, and the fact that it's very hard for people to perceive and to have a sense of urgency about the traditional frog in the boiling pot kind of metaphor, but the news cycle is a very short news cycle, et cetera. But this issue of climate exacerbated or global environmental change, environmental degradation generally, exacerbated disasters. the impacts of the the bark beetle on the wildfires, and then the rains and the mudslides which kill. Those stories are incredibly compelling stories. So I really like the point that you're making there, Gina. I'm not seeing anybody at the microphone. I'm going to facilitate a prerogative and ask another question of this group. And feel free to just ignore this question if you have something else you want to say. But one of the things that we are thinking a lot about right now within the Global Change Research Program is the gap between the science and the information that we generate and the decisions and the stakeholders that need to use that information. And one of the means by which we try to do this at a federal level is through what might be called boundary organizations. And some of those boundary organizations are things like the extension institutions of the USDA, the Landscape Conservation Centers, the Department of Interior, the RISAs, the Regional Integrated Science Assessment Centers of NOAA. But there are other kinds of boundary organizations. And, Neil, you've talked a lot about, the partnerships that you have to have as a researcher to be able to translate. And, sometimes researchers like you are able to do that because you have a lot of time and a lot of energy and ability to be in places. But sometimes we need, that kind of translational institution. And I just wonder if, from a One Health standpoint, of course, the agricultural side is very important. But does this workshop make you think about ways we need to innovate or change, or can we build on existing kind of boundary organizations to both generate the data we need for integrated surveillance, to be able, for that two-way flow of information to be able to do the things we're talking about? And again, feel free to think of another question, but that was just a question that I had.
Oh no, go ahead, Carlos.
Maybe related, yes, to how we use this information. This takes me to what I wanted to talk about, the global health institutions. It's convenient for me. And Josh talked, and Keith also talked about that. We do have multilateral organizations, international development banks, bilateral aid, foundations who do work at the try to influence global health in general. Some of them are very resistant, and somebody mentioned the Gates Foundation is very resistant to move away from infectious diseases into this. Here you have a major player that has to be addressed and move forward. But I want to suggest that a mechanism that is available for everybody is the use of multilateral forums by UNDP, FAO, and WHO through their regional or global organizations. In these policy statements, strategies, and guides that sometimes, once you have them, can become very influential. And I do think that this topic is one topic that has to eventually end up in a criteria document or in a guide or at least a policy statement by one of these organizations.
Thank you. And I have a big timer right in front of me, so Keith, I think I'm going to give you the last 50 seconds.
We
have one question.
Oh, sorry.
Oh, I'm sorry, Melissa. Melissa, why don't you ask your question, and then we'll have the wrap up.
Sure. I think I just want to weave together several different themes over the last day and a half related to training. And I can only assume that all of you on the panel were never trained in such a multidisciplinary way that you made it a absolute must, a requirement, priority, that if you're going to embark upon a certain research project, that you must have this other expert and this other expert and this other expert as a collaborator. At the same time, we lament that a lot, but I can reflect back in 20 years ago where an environmental health scientist was never encouraged to talk with a social scientist. And we're seeing how critical that is. So how about along the theme of emerging sciences and emerging technologies and paradigms, let this be an anchor moment where we say, going forward, no environmental scientist wants to embark on a area of inquiry related to infectious disease without an infectious disease physician, infectious disease epidemiologist, and other disciplines present. And so, too, no infectious disease doc would want to be thinking about vaccine efficacy without having the expertise of an environmental health scientist. How about saying that that really is what we aspire to accomplish? Is that too simple-minded, too idealistic? What are your thoughts?
Melissa, that's a fantastic question, and I think we sort of touched on it in terms of changing the incentives. So I think in terms of research, we have to change the incentives, as you mentioned, to make it obligatory, to be able to have a truly interdisciplinary, to bring in the biomed and the non-biomed folks. I can tell you from our perspective at CUGH, it has been really, really difficult, excruciatingly difficult, to bring in the non-biomedical folks. Now, we've got a working group on law and others, but we failed to bring in the business folks because they don't see what they're doing as global health. We failed to bring in an array of other disciplines. So we need the leaders and those who actually get it. Find it. We don't know who they are, but find a way to attract them and bring them in. And from that, we'll be able to attract some more. And also in this, we have the production of knowledge, but I think we also need to use those people for both biomed and non-biomed in the communication of the findings. We need to bring both of them involved in that part. And finally, just to, if I may add on to what Carlos said, John, I think that if you're going to affect politics, we have to understand what the incentives are for politicians. And they're not our incentives. I think there's and politics we know can be for the good and the bad. Right now, more than 70 regulations the EPA is being forced to roll back in the environment, in the area of environmental protection. The Interior is being forced to be able to open up protected areas for development, which is going to be extremely harmful to communities, particularly indigenous communities. But there's a lovely irony of where we are today. Because this building, this organization, the National Academies, was started by who? Abraham Lincoln. Politics at its best. So therefore, we know, just sitting here, our mere presence in this building amongst us in what this lovely, amazing organization does, is politics at its best. So we need to find out those people we need to inform them, mobilize them to work to use their power for the greater good. But there's another side to this, and I'll close on this, and we don't do a good enough job of this at all. The public moves the political. Politicians bank, when bad things happen, they bank on the public getting angry for a couple of days, and then that anger bleeds off when the next issue comes up because we're working in such a rapid news cycle, right? Something else will come up, the next shiny thing will come up. Our challenge, and it is a tough challenge, is how we are able to keep our issues on the front burner over and over and over again. And it takes time, it takes effort, it takes creativity to be able to make sure that these issues are going to be on the front burner for the public. Because when the politicians see that, hey, this isn't going away, and I'm going to be hit at the ballot box by not acting, that's when you're going to make sure that's when they're going to change. That's when they're going to act. So we have to, I think, remember that in the strategies we use.
Thank you, Keith. With that, we're going to need to close. We're 4 minutes over time. We'll close on the aspirations of politics at its best, and let us thank everybody. Give a warm round of applause for panelists at their best. This was a fabulous panel. Thank you very much. And we'll turn it back now to our opener, Dr. Newman, for his closing words. Thanks.